Are there any particular groups then that we should be focusing on, should be ringing our alarm bells in terms of risks as they walk through the door?
Well, I think every diabetic is at high risk. The vast majority of them are type 2 diabetics. They're middle-aged, they're overweight, and they have a multitude of risk factors. Most diabetics are hypertensive, and they may have some other risk factors on top, but they're in the secondary prevention group. There is no such thing as primary prevention in a diabetic. And so I think we need to be aggressive with getting them on the appropriate drugs, giving them appropriate lifestyle advice, controlling their weight, which is inexorably on the rise. That group we need to focus on. There is very good evidence that the Indian Asian population that lives in the UK has a very high risk. On average, you're likely to be 10 years younger when you have your first cardiovascular event, and your mortality therefore is higher. It's hard to pin down why that is, but let's just say it is, and therefore that's a group we need to focus on. Try and hunt down the diabetes in that group. The Afro-Caribbean population has a high risk of blood pressure and also a high risk of diabetes. The strange thing is that although they get a lot of peripheral vascular disease and stroke, their diabetes doesn't seem to affect their heart quite as much, and certainly their hypertension doesn't lead on to coronary disease. So there are some racial variations, but doesn't mean they're not a high-risk group because they're going to have vascular events.
And what about postmenopausal women? Because I think their risk starts to match up with men at that phase, is that right?
Yeah, so basically they lose the estrogen protection. And so as well as the symptoms, of course, they get, the question is how do you manage their cardiovascular risk? Well, there isn't anything in the risk calculators that says you're postmenopausal. And so if you want to fudge the risk factor, give them another 10 years because that's probably what's going to happen to them. So if they're 40 and they've gone through the menopause really early, then they're likely to soon behave like a 50-year-old woman or change their sex to a man and see what happens to the risk there. I think there are fudges you can put in because age of menopause isn't in the risk calculator. I suspect there's no doubt that they are at elevated risk, and so you should start getting more and more aggressive with their risk reduction. Unfortunately, HRT, which is great for the bones and helps their symptoms greatly, has a downside in that there is a signal at least that it might increase cardiovascular risk. Does that mean I'm not going to give HRT to anyone? Well, no. I think HRT has a lot of benefits. If they've had a cardiovascular event, then I'm often asked the question, well, is that it for HRT? Again, you're going to have to treat the patient. If there are lots of symptoms that come back because the HRT's been stopped, then the increased risk once you're on aspirin and clopidogrel, which you're likely to have been on with your acute coronary syndrome, the added risk of having HRT back on top when your platelets are really being mashed up by all those drugs, I suspect is pretty low. So I've certainly on occasion restarted the HRT afterwards, plus a battery of cardiovascular drugs.